In this segment of our Hospice is Hope series, we're joined by a distinguished family member of a Memphis cultural icon, Miss Willie Love. Is married to Andrew Love for many years of the Memphis Horns. And she's going to tell us today a little bit about what it was like to be part of that musical heritage, cultural heritage, and also to journey as a family member through serious illness. Willie, thank you so much for joining us today.
You're welcome. My pleasure.
Tell us a little bit about the fun times and about the Memphis Horns and what that was all about.
The Memphis Horns originated back in 1964 with Wayne and Andrew. They decided to patent their name.
Right.
And they went from there all over the United States and outside of the United States, touring with different groups.
And they've played for everybody, and Wikipedia or the internet can tell you what all they did. There were gold records and Grammys and all types of things.
Absolutely.
That resulted from that partnership. I think one of the things that I'm most proud of as a Memphian is that it was an integrated group. You had an African American and a Caucasian guy who were just making music together. And I know that for you that was exciting as well to see that develop.
It was, and especially in that time, back in the 60s. You know, that was a trying time for all.
Absolutely.
And Andrew and Wayne became brothers. I was just on the outside looking in.
Well, I think you were a family member too. You certainly helped to inspire him, I'm sure. Unfortunately, as time happens to us all, Andrew did become ill. Tell us a little bit about what it was like the first time he had to go into the hospital and what you were feeling as a wife.
Well, I believe that I missed a lot of the onset of his dementia.
Okay.
He did a lot of traveling, and because of that, it was only the times when he was at home that I thought he was just making notes about his next adventure. But as time went on, I realized that something was not right. And I believe it started when I noticed I had taken a trip to Chicago, and I came home, and Andrew was questioning me about the trip. He was asking, and we were talking, and he said, I was in Chicago. I said, no, you were not. And I looked at my son. I said, something's not right. And I looked at Andrew, and I said, and you're going to the doctor tomorrow. That was on a Sunday. So it started then in 2002 that we realized that something was wrong. After all the tests and the doctor visits, this is how we knew.
Okay.
And the way we came about with the living will, I believe you call it the advanced directive.
Yes, ma'am.
He was in the hospital for another surgery, and that's when we signed it, because we had to. We realized then that he would have to tell us what his wishes were, and then we, of course, the hospital wanted us to do this as well. So that's how we came to do that. We discussed it, and that's how I knew what his wishes were.
Now, in terms of discussing with Andrew, and you don't even have to get into the specifics of what he wanted, it must have been very emotional at that time, realizing that if he was losing details about trips and other things, that if his thoughts were to slip further, you would need to know what he wanted, because you were looking down the road, weren't you, and seeing that this disease would get worse.
Yes, and with us having 4 children, we had a lot of different emotions there.
Yes.
So at a time like that, you want to have something in writing so that everyone would be on one accord, and the one accord is his wishes.
Yes.
What he wants.
I think that's such an important point you bring up, Willie, because many times family members, let's say they're 4 children, 2 children, or 10 children, they want to kind of take a vote.
Absolutely.
And make it kind of a consensus.
Right.
And sometimes the patient's voice gets lost in that. And so it's so critical, even though Andrew was in for a different health care problem at that time, the hospital staff encouraged you to do an advance directive.
Yes.
And so that set his wishes for you as a family sort of in stone in a way that you could understand what he wanted.
And that was important because you have one child that may want one thing and another one want to do something different. But you have to look back at it's on paper.
Okay.
This is what Daddy wanted, so this is what we'll do.
I got you.
And that's how we went from there.
Andrew, for over 40 years, blessed not only the Memphis and Shelby community, but the entire world with beautiful music.
Mm-hmm.
And I want to thank you today for sharing that sound with us, because his example, even in his family decisions, is still blessing Memphians today. And we want to thank you for sharing this story with us.
Thank you for having me.
Next, we'll be joined by Kathy Huff, a practicing clinician who will help us understand the impact that advanced directives have when families like Andrew's and Willie's are sitting across from her in the hospital or clinic setting.